Hi, welcome to the DRH show where I have wide-ranging conversations with fascinating people. We talk about all things psychology, mental health, and wellness. Today, I'm joined by the founder of Steadfast Clinics, Stephen Small. Thanks for joining me.
Nice to be on the show, Dennis. Thanks for having me.
Well, I first have to say thank you to you, Stephen. I know it's a lovely Saturday afternoon and it's supposed to be self-care day, but you spared me a chunk of your time to tell us about what you're doing as the founder of Steadfast Clinics. So right off the bat, Stephen, tell us your background, your trajectory in life, and how you ended up doing what you're doing.
Okay. So that's an interesting question. Thank you, Dennis. So where I am today is I have a medical company which represents a US manufacturer of spinal decompression equipment, and this is a treatment which can help people with unresolved back and neck pain, sciatica. So we're very much interested in the sort of the wellness and care side of things, from the content for your show. Now, what my background was actually, I spent the first sort of half of my career working for a variety of corporates, actually. I started out with Thomas Cook, which is a well-known travel company. They don't exist anymore, sadly. And I was working mainly in Africa, and I've been to 34 countries. And at a certain point, I got introduced to this idea about a spine treatment which had been developed in the United States, and which was kind of expanding very rapidly. And it piqued my interest, and it just so happened that there was a clinic in Egypt, which had been set up by a Canadian neurosurgeon of Egyptian descent. And so I went to see this clinic, and I was just sort of blown away by the excitement of the clinical staff and the patients who were so pleased to be able to do something for people who were, pretty much disabled or really struggling with long-term back pain. And that's kind of where I kind of thought, okay, I had the opportunity to sort of distribute and to develop this treatment in the UK and Europe. And it was one of these pivotal moments where you think, I don't know too much about back pain. This seems really interesting, and I might kick myself if I don't, if I don't go for it. That was about 10 years ago, and here I am, and here I am today talking with you. I had a first half of my career quite different, and then the last sort of 10 or so years really heavily involved with working with clinics and working with spinal treatment.
And I've got to be honest with you, Steve. A lot of my questions will be coming from a place of ignorance because I'm not really familiar with your line of work.
Yeah.
But from my basic understanding is that you're working with this treatment called IDD therapy. So if you could kind of give us a snapshot of what kind of modality of treatment IDD therapy is. You already alluded to that this is sort of for back pain and wellness, but what exactly does this mechanism involve?
Okay. So perhaps if I'll put the mechanism, if you like, in the context of a brief view of back pain treatment. So back pain is the number one musculoskeletal complaint, and the second most common reason for visits to the GP. So it's a big problem, and pretty much everybody will suffer with a degree of back pain in their life. Now, most back pain will, go away by itself. You twinge your back and you kind of, you're not moving as well for a few days or maybe a week, and it goes away, and people might take some anti-inflammatories and things. If the back pain is not getting better, then perhaps someone will go to see a physiotherapist or a different therapist like a chiropractor or an osteopath to kind of see. Now, there are many different causes of back pain. Where we come in is where hands-on treatment and exercise programs aren't enough to address the causes of the problem. I have a spine behind me, but in terms of a basic sort of spinal anatomy, you have this is your spine. There are bones. I don't know if you can see here. I could bring it closer, and then in between the bones or the vertebra are these spongy discs, and they act as shock absorbers and allow us to kind of move freely. And they're stacked in between, or they're sort of wedged between these vertebra, which are kind of stacked like cotton reels. And these discs, are really important. Now, as we get older, we can the integrity, if you like, of these discs can come into question, particularly these days as people sit a lot, we slouch a lot, perhaps not as active, and a lot of pressure can be exerted on them. Now, where we kind of come in is when if somebody has back pain and there is if there's a disc involved, and I can talk a little bit more about it if you want me to, but then what we use a machine called an AccuSpiner. I'm just seeing if I've got a picture to hand. I can grab one. But we use a machine called an AccuSpiner, which essentially was developed in the late 1990s. There have been different tools, shall we say, to try to help back pain, and it goes back to actually 400 BC with Hippocrates, and there's a picture of somebody being suspended upside down with their ankles tied on a ladder. This idea that as we have become upright, we have compression acting down. So the idea that perhaps if we reverse that and we decompress, then we might be able to relieve some of the pressure on the spinal structures. Things have obviously evolved since hanging people upside down from ladders. But what's actually what happened in the sort of the 20th century was that physiotherapists would use mechanical devices called a traction machine, which was kind of like a winch, and a patient would be sort of harnessed to a motor, and then there would be a general pulling force to try to stretch the spine. Now, these were widely used in, you'd find them in every physiotherapy department in the country, and probably every physio department in the world. However, they were very imprecise, and evidence showed that they weren't very effective. So they went out of favor and kind of, just dissipated away. In the 1990s, there were some new technologies coming out in America, which showed that it was possible to sort of treat isolated spinal segments, and this idea of being able to decompress. I'm going to grab, if I just very quickly grab this, hopefully it doesn't fall down. I don't know if you can see, but this is these are the discs in between, and this red is where this disc has bulged outwards, and if it bulges outwards and presses on a nerve, this can cause pain or cause a chemical irritation. And so essentially what we want to be able to do is focus treatment on the segment where we have the problem. And so we have these machines which are called an AccuSpiner, which allows us to treat targeted spinal segments in a way that could never be done with traditional traction machines. So we have this with this machine, this AccuSpiner, which is now used in clinics. There's over 1,000 around the world, which are helping people with this sort of debilitating back pain, which is clogging up GP surgeries, and is the sort of biggest source of frustration amongst physiotherapists, osteopaths, chiropractors, because when people get stuck, it's very difficult to do something about that problem. Now, so, I'm kind of giving you various bits here.
Oh, thank you for giving us a comprehensive snapshot of what we should learn about our back. And when you said that we should really be paying attention to this, especially in my line of work. I've been doing this job for about 8 years now, so I just sit at home all day and face the camera, which is not really very healthy. And I just go to a chiropractor once a while, and I should really be paying attention to this. But thank you for giving us a snapshot of what inspired IDD therapy. You mentioned something about traction earlier, but I just want to learn from you, Steve. So do you think, Steve, that there are other medical conditions that traction or IDD can be used to treat, like more complex conditions such as scoliosis or osteoporosis, or is it just limited to back pain?
A good question, Dennis. So there are certain categories of condition, if you like, that IDD is suitable for. So we have this traction, and then we make this distinction now, the IDD therapy, spinal decompression. So this ability to treat targeted segments. So I'll just make that distinction. So conditions, there's obviously many conditions that can affect the back. And we have what's called indications and contraindications. So where you would treat and where you wouldn't. So the common problems that we see are for herniated discs. That's where the disc that I showed you is kind of bulging outwards. So that's a very common one. A condition called sciatica, which is the nerve pain that travels down the legs from the sciatic nerve exiting at the base of the spine. So if you get kind of compression on that nerve, then that's a lot of people really struggle with leg pain, we call it, and that can become serious. So sciatica, and then as we get older, there's this condition called degenerative disc disease, whereby the disc starts to sort of lose hydration, and things start to get a bit. The height of these discs in the height gets a bit shorter, if you like, and that can put pressure on structures in the spine. So we treat for degenerative disc disease. In terms of, so those are the kind of the most common. Osteoporosis, it's not a treatment for osteoporosis. That's where we have a loss of density in the bones, and sort of we're applying a sort of pulling force. We wouldn't want to do that for somebody who has osteoporosis because it could potentially cause a fracture. So we kind of want to rule out that. With a scoliosis, which is a curvature, we can treat if the area that we're targeting it hasn't got the scoliosis, but generally it's not a treatment for scoliosis. So someone might have a sort of curve, but generally they'd be having the IDD therapy for something, for a different part of their spine. I mean, there are other spinal conditions, but generally those associated with around problems with the disc and the effect on that spinal structure is the mainstay. It can treat the neck as well, so people get arm pain from nerves trapped in their neck, and so kind of that sort of unresolved low back pain and neck pain and nerve pain are the main ones that we would treat. But interesting, I'll just make a point actually as we talk about spine treatments, and this is a non-surgical, non-invasive treatment. What we would always stress is that this is not a cure-all. So there are excellent results for certain categories of patients, but sometimes other treatments are necessary. So whilst we don't really want to have spinal surgery, for example, for certain conditions, spinal surgery will be the right treatment for that particular patient. And my late father, he had IDD on his lower back, his lumbar spine, because he had some problems, and then he had a problem with his neck, which actually required surgery because he started to lose balance and things. So I hope that gives you a kind of overview of the main conditions that it's used for, and those which it wouldn't be.
Now, Steve, if I understand it right, forces which are applied to the IDD therapy. So, how do you sort of calculate these pulling forces just to make sure that it's within the safety threshold, if you will?
Okay, so I'm happy to answer that. So when we're applying these pulling forces, so a patient's harness, and I don't know if we can put a picture in here later, but the forces are calculated as a function of body weight, and it's actually done by, we take a patient's, we halve their patient's weight. So if somebody, and it's done in pounds because it's from America. So if somebody weighed 200 pounds, which is about 90 kilos, the treatment is done as a function of half of that body weight. And we would start modestly, because people have pain, with perhaps half body weight minus 20 pounds. So we use a very a low force, and if we think there's a lot of force acting down on us, so these forces are comfortable, and then during the course of the treatment, those forces are built up. So for your first session, you have a treatment force applied, and there is a protocol. So if we come back to our spine, we can see the red is where I can see that the red is where the disc is bulging outwards, and this can happen at different levels on the spine. And essentially, by changing the angle at which we apply the force, we can direct the decompression, the distraction force to a particular level to open it up. So coming back, so we're using a force to open the space, to decompress the disc, and to improve mobility. And then we are going to progressively increase the forces with kind of, not necessarily with each treatment, but over a period of treatments, the forces are increased. And we liken that a little bit. So if you do some exercise and you might start off with a gentle exercise, and then as your body gets used to that, then those forces can be, you can then tolerate more. Your body adapts to the treatment, and this is part of the concept that the treatment is a program of care. Where tension forces are built up over time.
Mm-hmm. I was just going to ask you, Steve, so how do you also target specific areas?
Yeah, so it's based on vector forces. I didn't do physics at A level, but I did a bit at GCSE, and I've had, it's been explained to me. So vector forces are basically our forces at a particular angle. And if we think of so if I'm pulling in a straight line, I'm pulling along. If I apply a force at an angle, the point of application of the force moves along, we will say, the x-axis. And as we steepen the angle at which we apply a force, then that point moves further along. So these discs, each disc has a number depending on which level, depending on which vertebra it sits next to. And then we have specific angles which these using vectors that we apply these forces to focus the force at that level. And the steeper the angle that we apply the force, then the further up the spine we go. What I would say, Dennis, is that most of the problems happen at the base of the spine. So we talk in terms of the L4 or the L5 disc. These are the two at the bottom. And you alluded to us sitting, and I'm like you, I sit a lot. And if we sit, and I'll grab my spine. I wasn't intending to use this, but it was a handy prop, and I have it there. So if we sit and if we're sitting like this, if we sit, we're putting a lot of force onto the base of the spine. So this is where it becomes so important to move about. But that also explains why those two discs at the bottom are kind of the most commonly common discs problems that we see. The L4 and the L5 at the base of the spine. Are kind of the main ones that have the problems. So we have specific protocols to treat those levels. We do get some problems further up the spine, but it does tend to be those. So any discussion about discs and things, and everybody starts to sit upright and improve their posture, and then once they finish, then they go back to kind of slouching, which is we say squashing the life out of your discs. So the trick is, Dennis, to make sure you get up and move often. Yeah, does that answer your question?
Yes, absolutely. And I was just wondering, what sort of time frame do we begin to see improvements? Is this something instant?
It would be fantastic if it was instant. That would be brilliant. So it's one of these in healthcare that awful expert. It depends. It does depend. So the original protocol was based on a program of actually 20 treatments over a 6 to 8 week period, which sounds like that's a lot, but people have been in pain for quite some time. Now, some people can once they go on the machine, they can experience pain relief fairly quickly. So coming back to if we've got our if our disc is pressing onto a nerve and you move that disc slightly, or the bulge draws back, you might take away the pain fairly, can be instantly, within a couple of sessions. However, what we're looking at, if you think about how much time you've spent sitting, for example, over the years, then all the tissues around that have adapted. So when you see older people with poor posture, that's the result of. That's not happened overnight. That's built up over time. So sometimes we have to really work the tissues to bring about the change in the structures, and then the pain sort of dissipates after that. So it would be absolutely fantastic if we could just put people on the machine once and they would be pain-free. But it's a little bit like going to do some exercise once, or going on a diet for the weekend and expecting to improve your fitness or lose weight. It does take a little bit of time. So especially with the sorts of problems that we're seeing, because patients, they've tried, or usually they've tried lots of different treatments. They might have even had some injections. So the structures need time to adapt. So some people can experience symptomatic relief fairly quickly. Others, it takes, into the second half of the treatment program before they start to feel the pain relief. But what we hope to see is that people are moving better as they progress through the treatment, and that's the key thing. So that when they finish treatment, they stay on this kind of long-term path of well-being, and avoiding recurrence of the problem.
And Steve, in terms of sort of demographics of your patients, is there a difference between age or gender, based from your experience?
So I would say there is a difference. There is a difference with age, I would say. So because there's different types of problems that people have. Generally, if people are older, then they take a little bit more time to adapt to the treatments and recover. So whereas if somebody is, I'm going to say, younger and fit, we're not being ageist, or if they're younger and fit, their recovery can be quicker than if somebody is older. But in terms of age, there's no upper limit to how people can go on the machine, and mature people, shall we say, can really get some improvement, and then others, it might be okay, they're aiming for degrees of improvement. They might not turn back to be 25-year-olds as they might like, but they can at least walk more comfortably, for example. In terms of gender, I wouldn't say there's any difference really. There's no kind of females get a better result than males. I'd say there's nothing in it there.
Yeah, it's just a misconception. Now, Steve, I understand this is, largely beneficial for patients, but it's also beneficial for practitioners, I would imagine.
Yes. So that's, I mean, it's interesting. So I work with a lot of clinics. So at the time we're speaking, Dennis, there's over 40 UK clinics using the IDD, and there's different types of clinics. So we work with different types of practitioner, physiotherapists, chiropractors, and osteopaths are the main ones who use it. And for some of the clinics we work with, they particularly the ones who are more experienced, they're a bit more, they're frustrated because they know the limits of what they can do. So with hands-on treatment and exercise resolves most problems, but then there's this category of patient that we're interested in, that they recognize that the hands-on approach just isn't enough to bring about the change. So for some clinics, it's actually it gives them a kind of professional satisfaction to be able to offer people that that extra dimension of treatment. And then for some clinics, there's thousands of different types of therapy provider, and clinics often will kind of specialize in this category of treatment. And in terms of if you're recognized as a sort of an expert in back pain, then some practices can build their practice around this type of condition, so that they specialize. And so therefore, people will seek that clinic out because they have that. But also they're also very experienced of dealing with unresolved problems. A lot of back pain, as I said earlier, is it's bread and butter for manual therapists and can get people out of pain and moving again. But that one who is stuck, where do they go? And so that's an opportunity for those for clinics who want to have this kind of specialism.
Now, of course, it's expensive to have, surgery, especially if you're in other countries where there's no NHS. But does the IDD therapy cancel the need for surgery?
So the way I'd answer that and say that IDD therapy can and does, help people avoid the need for surgery. So every clinic that I work with will have patients who have seen a consultant, a doctor, and they're at a stage in their treatment where they're thinking, actually, the only way to relieve your pain is perhaps to have an operation. And we know that for certain procedures, for example, a microdiscectomy, where if you have a bulging disc like here, Dennis, microdiscectomy sort of goes in and cuts, takes this part of the disc out, so it's not pressing on the nerve. Now, there are times when as I said earlier, the times when that surgery is very necessary, but actually we see a lot of patients where we can avoid the need for that surgery because the body will adapt and heal over time. So that's really positive. There are sometimes, as I said, there are times when surgery is the right thing, but we certainly see that we can help a lot of people. There's actually one study which was done by a US neurosurgeon, and in his kind of patient group, there were 129 patients who were considered surgical candidates, i.e. they would typically be going down a surgical route, and 92% of those, all of those who had IDD, 92% of those had at least a 50% reduction in pain and improved function. So 8% of that category of patients considered for surgery went on to have surgery, but the rest didn't. That's not to say that 9 out of 10 patients who are considered for surgery will not need surgery, but it's certainly extremely positive. And as a little anecdote, Dennis, we had a patient up in Edinburgh where a lady was due to have surgery, and the insurance company Bupa had agreed to pay for the surgery, and that was going to probably cost around £10,000. She didn't want to have the surgery. She went to clinic in Edinburgh for IDD, and she had a fantastic result and didn't need surgery. There have been some patients who have perhaps not wanted to have surgery, who have had IDD and perhaps haven't had a successful outcome and seen an improvement, and they've gone on to have surgery. Is that a failure? It's a shame when it happens. It's quite rare. But for all those, but the thing is, if you've had surgery, you can't undo having had surgery. Whereas we're keeping people on what we call the non-invasive, that's the non-surgical side of spine care.
Well, Steve, the second part of this interview will be exploring the human side of Steve. But before we jump into that part, can you just give us some quick tips on how we can improve, kind of avoid the back pain? Are there any special diets aside from the obvious one, which is posture, of course, or increasing your physical activity? Any other tips that we might have not been aware of?
So I will say that, Dennis, I'm not a practitioner myself. I co-own a clinic actually in London called Spinex Disc Clinic, and I work with all of the clinics. So in terms of that, in answering that question, I'm taking that from the people who I work with, and we've had a lot of articles published. So in terms of some things that people need to do, so staying hydrated, drinking enough water is really important, and the reason that is important to avoid back pain. And the reason that is important is, how when we're told to drink sort of 2 liters of water, it's going to help our body, help, our skin looks better, etc. Well, when the discs in our spine, they are mainly made of water. So if we are not hydrated enough, then they're kind of in the same way that our skin can be affected by being dehydrated, then that can have an impact on the walls of the disc, which are made of collagen. So if we're always not dehydrated, we're just drinking coffee all the time or something, then that can have a really negative impact on our discs. Coming back to the posture, Dennis, so clearly how we sit is a really important one, but also how long we sit for. So people, they sit in a slouched position, and then they don't realize how long they sit for. So getting up to move, we have a little tip. Actually, you can if you do work at your computer, you can set a little alarm timer to go off every 45 minutes so that you get up and you move around. At our clinic, we encourage everybody to walk. I think when people hear about exercise, it's often a sort of, it just conjures up images of boot camp or sergeant majors or school PE lessons, on a freezing January where, just awful. But just kind of going for a walk every day is a really valuable thing, because the spine relies on movement in order for the structures to remain healthy, and sitting and not moving is the number one enemy. So I think that the message would be, get up and move, go for some walks, and then if you can incorporate some, say, more active exercise, then that's going to be good. People, you hear a lot about Pilates is a kind of very classic one. So if you're in the absence of what should I do, finding a reputable local Pilates teacher would be something, or just finding an exercise that you like, that you can do fairly consistently. I think those are the main things that you can do. And then if you're not sure, then going to see a physiotherapist, an osteopath, or a chiropractor to get some tips to show you certain simple exercises. There's a guy called McGill who has some exercises for back pain, for example, which are really good, really gentle, and even just doing like 5 minutes a day can help look after your back. Before I came into this, Dennis, I didn't know very much about back pain. My late mother, she suffered with bad back, and people know people with bad back. And what I see, so I'm 50 years old. What I see working in this area is people, different ages, suddenly discovering spinal anatomy or learning about spinal anatomy because something is going wrong in their back. And I think it's very difficult when you're younger to think, I'm going to look after myself for the long term. But the more people can be aware of the small daily / regular things that they do to look after themselves, is going to pay dividends later down in later in life. So if people are getting a little bit of some twinges, you can look on YouTube for some stuff, of course, but just going to see someone and say, can you give me some guidance would be a good tip, I think. How's that?
Yes, and those are very important tips, especially right now. I think what the lockdown highlights is that because it transformed the way we work, a lot of people are working from home now, facing computer all day, is that we tend to forget our back and our posture, and that's really important. And like what you've said, it's important that we kind of remind ourselves to get up and do something physical. I don't have an alarm clock, but I have a cat which reminds me incessantly to feed her, so that serves as my alarm clock. But what wonderful tips!
Get a pet. Get
a pet. When it's hungry, it will remind you to get up and feed her. Those are lovely tips, Steve. Now, we thank you for sharing to us your wisdoms and expertise about back pain and how to maintain proper posture and how we could benefit from IDD therapy. Now, the last bit of this interview, I'd just like to kind of explore the human side of Steve. So the first thing that I want to learn from you, Steve, is that a lot of people who are watching this are actually young people, and they're trying to figure out what sort of career trajectory they will get into. So for those who wants to follow your footsteps, can you give us some tips, especially that you have a rather interesting career trajectory?
So that's a very big question, Dennis, and I think that. So I have 3 daughters, and I try to give them the benefit of my I'm going to say, I don't know, wisdom. So learn from the good things and also learn from the mistakes. As I look back, then I can see that certain things set me up to, I think Steve Jobs says, you can join the dots looking back, but not looking forward. But a key takeaway, I think, is I was always very intrigued in stuff and interested, and you're kind of asking questions about why and how. So people can have a natural, questioning, but there's this idea that you finish school, you finish university, and you stop, and then you just go out and you stopped. You stop learning. I think there's so much that people can learn. So equipping yourselves with different skills. There are probably far more far wiser coaches, if you like, to kind of guide on career paths. If there are very young people, then learning a language. So I stuck with French when I was at school. I was the worst at French, but when I finished, I went to university and I carried on with French, and that was what actually led me into West Africa, because I could speak French, and from there my career kind of developed. These days, I think there's so much following your, I don't know about following your passion. Sometimes following your gut instinct can be good, but it's also good to check that. I think when I made my career change, I was doing pretty well actually in my kind of corporate career, and then I actually got made redundant, started my own business, and I went into that business without really doing any due diligence, and I spent 2 or 3 years really struggling. And so there's this, so that was a mistake. When I went into the spine care, I didn't do much due diligence really, and I hadn't got a background in spine care, and it's taken a long time. And people look at what we have now and what we're doing, and it's absolutely fantastic. But I'm going to say the first 5 years were really hard, loads of rejections. This machine that we use, people just weren't interested. And perhaps I'm sure if I'd been a little less impulsive about it, I might have done something different, which would have probably been, from a financial security point of view, have set me up a little bit differently. Than actually I can see this thing really works. I'm hoping it's going to carry on the way it's going, and I have no reason to expect it. So the summary, I suppose, back from that is, before you make a change, if you're going to do something yourself, really do homework. Do a lot of homework on it. Learn as much as you can about it, and try to, obviously, if you've got a passion for it, then that's even better, because in those low moments when things are really not going well, then that's the really hard part, and I'll share with you, there's been times when I've waking up at 4 a.m, that kind of classic stress, hunched over, crying, just like, oh my gosh, how am I going to get out of this? I think when you don't do your due diligence properly on anything, then you can set yourself up to fail. There's that kind of enthusiasm at the start. You can have a lot of enthusiasm at the start of something, but actually the successful ones are the ones who can kind of get through. Maybe I wouldn't have gone into this if I'd done more due diligence, because I didn't appreciate the obstacles of I'm changing spine care. I'm trying to change the way the medical profession treats back pain, and I thought they would just want to do it. Well, actually there's a whole process. So I think that kind of doing things for yourself is good. Do your due diligence, keep learning, start on a sort of personal development. If you start down looking at leaders in sort of personal development, that one will lead to another, and you just keep absorbing those, because you've got to have a better life, you've got to become a better version of yourself, and you just do that through probably listening to you more than me, but there's plenty of inspiring people out there who can set you on your path. That wasn't really a one-word answer.
No, thank you for sharing to us your insights.
Sorry for that.
And speaking about inspiration, Steve, I was just wondering if you have sort of like, is there someone who inspires you both professionally and personally?
Oh gosh, it's funny when you various things went into my head then, in terms of inspiring figures and those kind of cliched ones, I suppose, in terms of the big names and what they've done, and we know all about them, and I watch them on YouTube and I absorb that kind of the Steve Jobsy type stuff and all the rest of it. I got a little bit emotional then, just because I was triggered. My wife, so she's a teacher, and when I first met her, she was a teacher for children with hearing impairment, and I saw her in a classroom with 8 kids, and she was signing to them. And when people are deaf, then there's a much stronger kind of visual connection, because there's a lot more communication, visual communication. And so in terms of who's inspired me, but the way my wife has dealt with that, and the way she interacts now helps children with special needs, kind of, there's a lot of BS in the world, and then I see what my wife does, and how she helps people who have absolutely tragic situations, and then she's just trying to support these kids. So I'm going to go my wife. How's that?
Absolutely. I used to work for a special needs schools in London, and I can really attest to the effort and dedication of the people who work at those kinds of institutions. So yeah, your wife working at a special needs school would really be a good choice as someone who inspires you. Now, you mentioned earlier that you're kind of changing the medical field through spine care, but do you have any professional dream?
By professional dream, I mean, I'll tell you what, my vision and my dream of this is I kind of I have a map on my wall which shows me where the clinics are, and I've kind of got a vision for how many clinics there will be in the UK at least, and that is, I don't know if that is a professional goal. When I first started, so I kind of have a goal. So I have a financial goal, because I need my business to provide for my retirement, and should my daughters choose to get married, then there's weddings to pay for. So there's a financial need within a business to be successful. I want to expand the network, and when I talk of changing spine care, I think I'm gonna look back. I don't know whether I can actually measure when that will have happened. Perhaps when there's something called NICE, if NICE kind of approves as a sort of an approval, if you like. But also, when I first started, I had a few people, because I had this big kind of career change in terms of what I was doing before to going into spine care. And people were I was just really surprised that people I knew, it's that classic thing of people dismissing and being critical and being cynical. So I was having, trying. And obviously, if somebody has an opinion that something doesn't work, then that is one thing. If those people are, close-ish to you and they're just knocking it. There were also some professionals who were very kind of dismissive. And I'm someone who's much more interested. I want to ask questions. So something might not be perfect. I want to find out about the bits which do work. And there's a little bit of me that wants to show them, to have that satisfaction. But the biggest thing really, the thing that really gets me out of bed in the morning is when I hear from the clinics that somebody's life has been changed with the IDD therapy. So that's something which kind of feeds me along the way. But my professional vision is to have a certain number of, there was 250 clinics in the UK using IDD therapy is what I have on the wall. I've got a timeline for that as well. That will be a professionally very satisfying and fulfilling time when I do that. And hopefully that will mean that the business has also moved on, but that's really secondary. The amount of sacrifice that we've had to get to where we are is incredible. So I'm all about being fulfilled from this, and pensions and weddings, that's hopefully comes on the back of it.
Absolutely. And Steve, what do you think you would be doing if you didn't become the founder of Steadfast Clinics?
I I mean, it's interesting. So I had 2 or 3 different jobs. You know, I had my own business working in Africa. I started out in West Africa, all over West Africa, really. And then as my experiences developed, then you know, I was traveling. I was traveling a lot and going to a lot of different places. You know, in places that people don't tend to go to. You know, Mauritania, Congo, Sierra Leone. You know, all sorts of places. I think I would have probably just kind of carried on. You know, in terms of a career path, when you get a certain level, working in Africa is I absolutely loved it, you know, but it requires a certain way of working. It's not the same as working in, you know, Bedford or something like that. So I suspect I would have just carried on, you know, working in different organisations and hopefully growing and doing something positive. Yeah, so something in Africa. I installed a machine in Nigeria, which was great to go back. Really nice clinic. And this year I sold a machine to a clinic in Ethiopia. I was due to install it next month, but unfortunately Ethiopia is on the red zone, so I can't go back. So anyway, hopefully I get more opportunities to go back to Africa once we lose the red flag status of places. So yeah, probably something in Africa, Dennis.
Yeah, we all want that loosening of red flags, because we're all itching to travel. But finally, Steve, the floor is all yours. Tell us what else is in the pipeline. If people wanted to reach out to you, what platforms can they get in touch with you at? And again, remind us of what Steadfast Clinics is all about.
So Steadfast Clinics is all about changing spine care and working with manual therapists to change the way and do more for patients. That's what we're about. So Steadfast Clinics is just the name of the company. The treatment is called IDD therapy, and that's our website is iddtherapy.co.uk. So you'll see me on some videos. I'm normally wearing a shirt and tie, but it's Saturday, Dennis, I'm afraid. So yeah, that's probably, you know, I'm on LinkedIn, Stephen Small. If you look for Stephen Small, Steadfast, or IDD therapy, you'll probably find me. I'm not that regularly on Instagram and Facebook, but we do have some IDD therapy pages on Facebook, so you can see some stuff there and you can connect with me. In terms of other things, I mean, I have a couple of we actually have some liquid supplements actually that we supply to clinics, which have more nutrients than any tablets. That's a kind of side project that we have, and that's enough to keep us going. And then yeah, we have the clinic in London. At one point we did wonder if we could have a whole network of clinics, but actually running a clinic is quite demanding, and having more clinics can create more headaches if you're not working in them all the time. So yeah, so I've got plenty to keep going with, but yeah, so that's where we're at.
Yeah, sounds exciting. Well, what I'll do, Stephen, is I'll put all those links. So for anyone who feel that they could benefit with IDD therapy or any other services that Steadfast Clinics offer, they can get in touch with you. I'll also put a link to your social media channels. But Stephen, thank you for sharing to us your expertise, your insights about IDD therapy. It's a pleasure having you here on the DRH show, but unfortunately time is against us. I look forward to hearing more about your work. Thank you.
Thank you so much. Thank you.